Hi, I'm Dr. Javen Moore, and I'm going to talk Rickettsia. Rickettsia is a common co-infection of Lyme. It's in about 5.6% of Lyme patients when we looked at a study of over 3,000. So what is it? It's Rocky Mountain spotted fever. It's one of the most commonly diagnosed co-infections of Lyme because on blood testing, it's a little more easily caught. So I have lots of patients that walk in that say, well, I've got Rocky Mountain spotted fever, and that's what I'm diagnosed with, that's what I'm being treated for, yet they also have probably Lyme or Rickettsia, Bartonella, Babesia, these other things, but those are more difficult to diagnose through blood tests. So that's one nicer thing about Rickettsia is the blood test is more often ran. So let's get some other details. There are more than 26 different species of Rickettsia. It can get into blood vessels and it causes a lot of damage to the blood vessel lining, leading to permeability of your blood vessels so that it can get out into your body and create more havoc, doing more damage. Some other things that you can do is, it is a really quick transmission, so it's gonna get into the body very quickly. It's gonna get from that tick into you. It doesn't take a long time, so if that tick has penetrated your skin, the Rickettsia is going in. Also, it decreases your immune system, weakening your body, allowing for other infections and itself to do more damage and gain more ground in your body. So it's something that the longer you have it, the weaker your immune system is going to get. It creates a fever. This fever can be life-threatening. So if you have a growing fever and you've been bit by a tick, you absolutely need to make sure that you get this under control because this can end your life. It is dangerous, so make sure you get that taken care of. It creates a rash, and that rash can be around your wrists, elbows, and a lot of other places in your body, but it does create a rash in about 85% of patients. So if you're rashing up on your skin after being bit by a tick, consider Rickettsia as one of those possibilities. It's blood test-wise, it can even show up as creating anemia and elevating a liver enzyme panel. So the ALT, AST can increase when you have Rickettsia. It can also increase when you have parasites and many other infections, so be careful. That's not a Loctite diagnostic tool, but it just says, hey, pay attention to your body, look for infections. If you have an elevated liver panel, look for infections. If you're not doing other things that cause liver damage. If you have a substance abuse issue, yes, your liver can go up. It's not necessarily due to infections, but if it's out of the blue and you're a fairly healthy person, think outside the box. Think, what infection may I have? What toxin may I have? What's stressing out my liver? So what do we do to support Rickettsia? Well, a little differently than some of the others. I'm gonna be thinking lymph because we gotta clean everything out because as that infection is creating damage to your vessels, that damage is being cleaned, put into your lymph, then your lymph's gotta clean it out of your body. And so that makes me think, man, if we can get the lymph supported, that's at least gonna keep us from crashing. And then we've gotta make sure to support the brain because as the fever goes up, we can't let the brain get damaged. So we've got to do things like oxygenating the brain and supporting the mitochondria of the brain. There are more mitochondria in the brain than any other part of the body. A mitochondrial, or a cell in the body has up to 10,000 mitochondria in the brain, more around 5,000 in the liver, and 2,000 or less in most of the other cells in the body. So the brain needs that mitochondrial support. So what do we do for mitochondrial support? Well, you've got to think about, you need the cofactors, so you need your B vitamins. You need the glutathione so that you can support the liver and the immune regulation so that when the mitochondria start to crank on the energy and the body starts to function a little bit better, that you can be cleaning out through the liver. You also can take a product that I really enjoy called MitoATP. That product helps to support mitochondrial function, getting them regulated up a little bit further, and then that starts to push the energy, getting you well. So those are some pieces about Rickettsia that I like to do right there. As far as treatment, I like to use several different herbs, but it's all specific based off the patient and their co-infections. I get that question a lot. What herb would I use for Rickettsia or Rickettsia or Borrelia? And honestly, those herbs change. The products I use change person to person because every person is unique. So there are a few that I like. You get your Japanese knotwood, your cat's claw. You can even use some things like astragalus and your silvers, but the combination of those is key. One won't get the job done by itself. So just make sure that when you're combining these herbs, you realize that you've got to support liver, lymph, brain. You got to make sure you're detoxing out because long herxes are only going to hurt you. So anyway, That's 5 minutes on Rickettsia. It was brief. It was just a top level, just get an idea out there so that you can get some knowledge, because knowledge is power in health. We've got to take care of ourselves and advocate for ourselves every single day to go, well, share this out, make sure people are knowing what's going on with their body. Make sure that you know the different types of infections you're dealing with, especially if you already think or know that you have Lyme infections. Share this out. Thanks.